Today, we're discussing the correct way to floss.
Floss is a thin piece of string that we use to clean food, plaque and debris from between our teeth.
I recommend for my patients to brush twice a day and floss at least once a day to clean between your teeth where a toothbrush can't reach. We do this to help eliminate the bacteria that causes decay and gum disease.
If you consider a tooth, it has 5 different surfaces.
The occlusal, mesial, distal, buccal or labial, and palatal or lingual.
When we brush our teeth, if your teeth are close together, the toothbrush bristles can't clean in between the teeth because they can't physically fit. In those small spaces, we use floss or interdental brushes to clean where our toothbrush cannot.
This is my method of flossing and what I recommend to my patients. Wrap a long piece of floss around your middle fingers, not too tight. Hold a small length of floss and use your thumb and index finger to hold and guide the floss. This will give you more control during flossing. Gently slide the floss down between your teeth, being very careful not to snap the floss down. Hug the floss tightly to the side of each tooth and wipe gently up and down, following the contour of your teeth, ensuring that it goes underneath your gums. Keep in mind that we are trying to clean the teeth where the toothbrush is unable to reach. Slide the floss back and out to remove the plaque and debris, then go back in and follow the same process for the adjacent tooth. Do this for your whole mouth. Now have a look at this gum tissue. This is called an interdental papilla. We don't want to disrupt the papilla, so be mindful to work the floss around the papilla.
There are different types of floss, different materials, different thicknesses, waxed versus unwaxed, flossettes, and there are even interdental brushes for larger gaps. Your dentist, oral health therapist, or hygienist will be able to recommend the best products for you, and they'll be able to show you the correct way to use it according to your teeth.
If your gums bleed when you floss, this is most likely because your gums are inflamed because you haven't been brushing and flossing correctly. Don't stop flossing if this happens. Keep brushing and flossing as directed, and your gums should start to improve in health over the next 2 weeks.
If your gum health does not improve within the 2 weeks, please visit your dentist as soon as possible.
Remember, if you have any concerns, see your dentist for further advice. Thank you so much for watching. We hope you learned something new about flossing. Let us know in the comments what you'd like to know more about.
If you enjoyed this video, like and subscribe to stay up to date with our uploads.
We also have a podcast, the Medical and Dental Podcast, which we'll link down below.
And remember, a healthy mind and a healthy body lead to a healthy and happy life.
See you next time.